What do you do?
I'm Ultrasound Manager.
Oh, it's nice to meet you. Now, I'll just be asking you a few questions and you just give me your insight into them. As an ultrasound manager, if you were interviewing a new sonographer, what's one question that you would ask them?
I'd certainly ask them about the trust values for the trust that they were applying into to make sure they understood what the trust values were and how they were going to implement them in their work.
Oh, that's very nice. Thank you. And then the other question I would ask is, what is one piece of advice that you would give to someone who's preparing for their first NHS sonography interview?
To be honest, and to listen to the questions and only answer the questions and don't waffle. So prepare well based on that, really, to listen to the questions carefully and answer concisely but thoroughly.
Okay. And is there a real reason why it's important not to waffle?
Because we score interviews and we haven't got all day to listen to waffle and they'll score nothing, So we've got a system of marking and each valid point earns a mark.
Okay.
So it could make the difference. If they spend 5 minutes waffling and haven't answered the question, they get 0 points.
Oh, that's very insightful. Thank you. And which interview question do you think that every sonography applicant should prepare for in your experience?
I always ask about work ethic. I like to know that patients will be seen and the sonographers will be courteous to the patients and that patients who are late in the department won't be sent away. So I always include a question about work ethic and care of the patient, which, roll into one question.
Oh, that's very, very helpful. What is one advice that you would give to international sonographers who are applying to work in the UK?
The biggest piece of advice will be to be honest on your application and where it asks for experience. Only give lists of experience that you actually have, and it's not a list of examinations you may have seen only once. You have to be competent and confident in that area before you include it on your application for a post.
Okay, and that would be because one of the challenges I presume you guys see is the fact that some applicants list that they do so many things, right? Is that the case?
It is, and I don't believe it because somebody who's been qualified for 2 years cannot have all those skills.
Yeah, because some do say they do MSK and, vascular together with obstetrics and all of those things. So in your experience, someone who's just recently qualified will not have that much experience in these areas, yeah?
Yes, exactly. They may have seen one and been able to tick it off in a logbook to enable them when they were doing their education. But to claim expertise in that, I would expect to see an additional diploma or an additional certificate.
Okay, that's very helpful because sometimes it is a case of knowing how to do it. They know how to do it to some extent, but it may not just be to the extent that you believe they can do it. And it might take a little bit extra to prove that to you, isn't it? Yes. So it's good feedback so that, international applicants can see this and, just be guided accordingly. So thank you so much. Thank you.
Thank you for your time.
All right, that's fine.